Chapter 28, Part 2. We're going to finish up the infectious diseases here. We're in childhood illnesses. Obviously this is a picture of a guy with chickenpox. While chickenpox is typically considered to be a childhood disease, it certainly does affect adults from time to time. In fact, when it does affect adults, it's actually those obviously that didn't contract chickenpox or get the immunization as a child. Most of the time chickenpox is a one and done sort of thing, unless you had an extremely mild case of it to begin with. I myself had a very slight case of chickenpox as an infant, and then when my brother and sister got it when I was around 10 years old, it hit me with a vengeance at that time. Sometimes adults will make it all the way through into early adulthood, and before they come down with the chickenpox. Now with the advent of the chickenpox immunization, some people will not come down with chickenpox, but when it does affect adults, it typically makes them extremely ill. So the MMR and C, all these have vaccines. Mumps is a viral infection that affects the glandular tissue. Typically the glands in the neck, typically right underneath your ears. So the parotid glands typically are affected, as well as the testes in males can be affected. You have lymphatic tissue in a lot of places throughout your body. Those are the places that it most commonly rears its head. These usually are fairly minor diseases. Typically causes some painful swelling more than anything. The measles and rubella, these are both a rash-style illness, also viral in nature, and again pretty minor, except for when contracted by pregnant women within the first 20 weeks of pregnancy. It can cause some birth defects. Chickenpox, or varicella, is a medical term for that. And again, is the general malaise, itchy, fluid-filled blisters. They end up crusting and scabbing over on the skin. It is also the same virus that causes shingles. So once that virus goes dormant in your body, it can be reactivated, usually in times of extreme stress and immunosuppression, and it can cause shingles. And again, shingles travels typically along a nerve route and inflames things along that same nerve. Rubella. Rubella is, we already mentioned that one, sorry. Yeah. And then, got that one. Meningitis. Meningitis is a variety of different causes, typically viral or bacterial. Viral is the nicer of the two. The bacterial can be fatal, and signs and symptoms, there are a couple of key ones in here. This obviously affects the central nervous system since it affects the meninges, but the typical general illness complaints of fever, headache, nausea, vomiting, those sort of things occur. But then you also get the photophobia, like that of what would be similar to a migraine, a stiff neck, or what's called nuchal rigidity, where they can't touch their chin to their chest usually. And in severe cases, also seizures and altered mental status. There is some immunizations for bacterial meningitis, but it's typically contracted via airborne droplets, so say like sneezing and nasal secretions. So it's a good idea to wear a mask. Really, it's very symptomatic treatment, and again, it's going to depend on what type of of meningitis they come down with. Remember, you might also see the purpura rear its head in meningitis. And you can also, and when you see that, usually when you start to see the meningitis bacteria get into the blood, and it causes that meningococcemia. But again, a lot of it is very symptomatic treatment, and also is supportive in nature. So again, oral nasal secretions, treat it symptomatically, treating things like hypoxia, sepsis, and hypotension. You can also get an encephalitis. Encephalitis may or may not be meningitis related. Encephalitis is an inflammation of the brain tissue itself, so it could be a similar pathogen as the meningitis, but it may be completely on its own. And the examples that they're giving here are things like West Nile and some of the other insect-borne illnesses. Herpes can cause it. Toxoplasmosis, which is a type of a fungi that can get in there and cause some encephalitis. So there's a lot of things that can get up in there and cause it, but basically they look very similar. You probably won't have the complaint of nuchal rigidity in the encephalitis. You could have some nausea, vomiting, seizures. So if we have patients that are suggesting that they have a fever, headache, photophobia, stiff neck, and that purpural rash, it's a good idea to let the emergency department know ASAP, because they're probably going to want to isolate that patient. Because if it's bacterial meningitis, there's that potential to spread that to a lot of people. So it's standard precautions. It's better to over protect yourself than it is to under protect yourself. We have some other vector-borne illnesses where we'll bring up things like Lyme disease, tularemia, Rocky Mountain spotted fever. Rocky Mountain spotted fever is the most severe. Most of these are related to ticks, and whether it's dog ticks, wood ticks, deer ticks, can affect you over a week from your initial exposure. But again, it's very nonspecific symptoms: rash, abdominal pain, joint pain, diarrhea. Those are the ones that tend to pop up. So again, it's one of those that it's very tough to say, am I just sick, or do I have something that I really need to be worried about? So Lyme disease is a bacterial infection caused by black-legged ticks. And the characteristic sign is a red circular bullseye rash at the location of the bite. But other than that, outside of swollen lymph nodes, everything else is kind of general illness symptoms. It can lead to Bell's palsy, meningitis. Bell's palsy, remember, affects a specific nerve tract that controls some of the facial muscles. They don't have any of the other signs or symptoms of a stroke, but simply the facial droop. Rabies. Rabies is fairly uncommon, but it is fatal in humans. It's fatal in just about everything that it comes into contact with. It is transmitted through saliva, through bites of infected animals, and it only affects mammals. So bats, raccoons, coyotes, skunks, foxes, and it is viral illness that attacks the CNS system. It also is sometimes referred to as hydrophobia because it causes them to have, with the excess salivation they have and the fear of water, they are often foaming at the mouth. So now, is that something we're typically going to see in the adult or in the human population? No, but you might see something like drooling because this virus attacks kind of the salivary glands. Most of the time when there's a bite, that's obviously a big deal in the United States, and there's usually going to be police reports filed, and the animal will be, they'll either try to catch it and confine it, or it'll be under observation, strict observation for some time. Most pets are required to be immunized against rabies. I believe it's a 3, 4, 5-year immunization. They go back in every so often and get boosted. Tularemia. Tularemia is another bacterial disease of animals, typically of rabbits and rodents. Only about 200 cases per year in the United States. It's been identified as potential for a bioterrorism agent. Infection can be fatal if it's not treated, but basically it develops skin ulcers, sore throats, mouth sores, eye inflammation, dry cough, weakness, pneumonia. So the general signs and symptoms of infectious illness, they can develop, same thing that I just told you, sorry. Gastrointestinal illnesses, so foodborne. We can have things such as foodborne or waterborne, or even oral fecal route of transmission. Remember we talked that hepatitis A and E were oral fecal. So we have a whole slew of potential causes. Could be things as simple as E. coli, salmonella, norovirus, staphylococcus bacteria. Could be talking things such as botulism, which is pretty severe. People with food poisoning typically are complaining of abdominal cramping, nausea, vomiting, diarrhea, and occasionally a fever. They're really just trying to expedite getting that stuff out of the system. So vomit it up or shoot it out the other end. Either way, get it out. Botulism, this is typically found in low acidity canned foods that are improperly processed. One other commonality that they've seen to it is when people get dented cans and there's a little pocket of air that can form. If that little pocket of air can form there in the corner, it can be the place in which botulism tends to grow. It causes paralysis, like I talked about earlier. It blocks the release of acetylcholine in the motor neuron, so it makes it basically the same as our succinylcholine. It's fairly uncommon, but it is, again, very neurotoxic. It could potentially also be used as a bioterrorism agent, and they also have noted that it can affect the skin of IV drug users. So infants are the highest risk for botulism at 6 weeks to 6 months, but can occur at any time during the first year. And it's mostly contracted through things such as honey, corn syrup, and dirt that contains botulism spores. So that's why you hear, do not give infants honey. So it's fairly uncommon, but there are some things that maybe don't get, they're biologic in nature, and then probably don't get as sterilized as they could. All right. Small amounts of botulism can be ingested and then be eliminated from the body without harm. Again, a lot of these bacteria are fairly normal. E. coli, for example. Everybody has E. coli. You have E. coli in your gastrointestinal system, but it's kept in check by your body. So when your body can't deal with it, or for some reason there's an overabundance of it, that it becomes a major issue. Herpes simplex 1. So herpes simplex 1 is an outbreak basically of lots and lots and lots of little cold sores. This is probably a pretty extreme case. But the other common saliva-based illness that we typically associate with childhood is mononucleosis, or mono. Mono is a viral infection, causes fever and fatigue, and it can really wipe people out for a long period of time. It does have some upper respiratory complaints such as sore throat, swollen tonsils, and enlarged lymph nodes. It is transmitted via saliva. About 95% of the adult population has had some sort of an infection, although they probably have just developed antibodies. Herpes simplex. Herpes simplex affects the mucous membranes in the skin. They usually say this is the herpes that affects you from the belt up. It results in these blisters that will eventually ulcerate. They might also cause a little crust on the outside there. That virus remains dormant and does not go away. So generally these cold sores can have an eruption in your body and then lay dormant, and then years later they can rear their head again. A person with herpes simplex 1 or cold sores on their mouth can give that another person herpes simplex 2 to their genitals, and so then they would develop the genital herpes from cold sores that another person passed on to them. So genital herpes, delivery risk to infecting your baby is approximately 30 to 50%, particularly when a woman is newly infected late during the pregnancy. The mother hasn't had the chance to develop those antibodies. And then women with older herpes infection have already got the antibodies, and that helps protect the baby. We have some external parasites and skin infections, such as scabies, lice, and ringworm. Both scabies and lice are caused by an external parasite, basically a little mite or a bug that will affect the skin and the hair. Scabies burrow into the skin and lay their egg. Causes a rash with intense itching, and then is transmitted through via skin-to-skin contact with the infected person. Norwegian scabies or crusted scabies typically affect the elderly and immunocompromised, and they're typically treated just with a little topical lotion or cream. Lice are the tiny insects that infest your body, basically using your hair as a place to deposit their eggs or their nits. And being infected and infested with lice is being referred to as pediculosis. There are head, pubic, and body lice. The ones we talk about the most commonly are head lice. It is not, although it is in many cases considered a hygienic issue, it's really not a hygienic issue. It's actually kind of a luck of the draw sort of thing. I mean, we've all had people around us who had head lice. We may remember kids in school that came down with it, and they can easily pass it on from just sharing things like combs, bed linens, hats, things that kids do. Here, let me wear your hat, or they wear somebody else's coat or whatever. Body lice will lay their eggs in your clothing, but they feed from your skin. That is more common in poor hygiene, crowding situations, homeless shelters and whatnot. Pubic lice are spread through sexual contact. They can be found in the areas where you have the coarse hair, so your chest, axilla, beard, and of course your pubic region. Any cases, they're treated with a variety of shampoos and lotions. Some of them are prescription, some of them are over the counter, but they will tend to cause itching when they're feeding from your body, and the most common sign that you see of these are when you see the nits or the egg sacs that are on the shaft of the hair. Ringworm. Ringworm is actually not a worm. It's a fungal infection called tinea. Tinea corporis. It's in the same family as those that cause jock itch and ringworm. I'm sorry, jock itch and athlete's foot. Tinea is this fungal infection. They once thought it was a worm because of the kind of welt that it forms here. Kind of see how it maybe looks like something's tunneling around underneath there. It's more common in the humid, warm environments and those patients with immunocompromise, although I think it's pretty common for people to catch a ringworm at some point or another. The most common place to get it is either from your pets who have been out in the contaminated dirt or from being yourself out playing in the contaminated dirt. It's actually relatively easily treated by some ointments and creams. It's typically an itchy circular lesion, and it can be spread from person to person. But like I said, for the most part, pretty easily treated. Impetigo, this is usually caused from a strep or a staph infection or a bacteria. This is more common in children than it is adults. This is probably one of the #1 problems that wrestlers face. They have impetigo and it gets spread on the mat, and then a little mat burn, and somebody picks up that impetigo. And it causes a fluid-filled little rash that kind of gets a little crusty. It's usually fairly itchy. It can be painful sometimes. Usually an antibiotic ointment is used to treat it, but if that doesn't fix it, then they may end up having to be on an oral antibiotic to get it fully fixed. A boil. Boil is an abscess. So this is kind of like a super zit, but it's an infection within a hair follicle or an oil gland. A cluster of boils is called a carbuncle, usually caused by, again, another staph. And in many cases they are just basically home treated using warm compresses that helps bring them to a head so they can then drain. Sometimes they have to be lanced, sometimes they have to be drained, and then antibiotics occasionally. MRSA, or MRSA, is methicillin-resistant Staphylococcus aureus. It's resistant to most of our antibiotics used to treat them. It usually affects the skin. It can cause little vesicles. It is one of the most common nosocomial infections or healthcare-acquired infections. Some nursing homes may have a very high prevalence of MRSA. Another commonality to this, people who have been to some of the VA facilities. VA is, for some reason, had a large outbreak of MRSA a number of years ago. It can have some fairly serious infections, including making you septic. And then we can get to the STIs, or what formerly was called STDs. So the most common signs or symptoms that go along with this, it affects the genitals, but can affect other structures. Certainly can some of the worst case scenarios get into the central nervous system and cause some pretty ugly effects on the nervous system. And it's best to avoid contact with those skin lesions and discharge. All right, so always washing your hands after any contact. Gonorrhea. Gonorrhea is a bacterial infection, causes painful urination and purulent urethral discharge in men. It may be asymptomatic in women. and that can be treated with antibiotics. Syphilis, the bacterial infection, is transmitted sexually through contact with the lesions. Untreated infected women can pass it on to their fetus, which can lead to what's referred to as congenital syphilis. So the different stages of syphilis: the primary stage, approximately 3 to 6 weeks after exposure, a painless lesion called a chancre occurs at the site of the exposure. The regional lymph nodes can be enlarged. 5 to 6 weeks after the chancre heals, the patient develops a rash on the palms of their hands or the soles of their feet, a rash in warm, moist areas, and a loss of hair in the affected areas. The eyes, the kidneys, or the CNS can be affected. Latent syphilis, so signs and symptoms disappear for a period of time. It can be months to years. During this time, secondary stage symptoms can reappear, and 1/3 of these cases develop tertiary syphilis, in which the patient has painful lesions to the skin and bones. Cardiovascular system can be affected, leading to aneurysm. The appearance of neurologic signs and symptoms indicates neurosyphilis, which leads to dementia. I believe, I really want to say Fidel Castro had or has syphilis. Genital warts. These are fleshy growths caused by the human papillomavirus. It's been associated with a high risk for cervical cancer in women. There is a vaccine available for several different strains of HPV. Again, it's kind of a crapshoot as to which strains it truly is, but the most dangerous strains they have developed the vaccine called Gardasil for. Chlamydia. Chlamydia is caused by an organism that has characteristics of a bacteria but lives within the cells, and it can affect your eyes and your respiratory system. Babies often get a preventative or a prophylactic treatment once they're born in the form of some ointment in their eyes to make sure that they don't get affected by actually a couple of these STIs, and it can be spread through secretions or contact. All right, so recognizing some of the characteristics that are common to these various diseases help us to protect ourselves and help us to kind of develop an understanding of the processes that are going on. The general signs and symptoms include things such as malaise, fever, chills, muscle joints, pains, swollen lymph nodes. Recognizing the signs and symptoms can help us anticipate any of these complications that may crop up. Coughing, stridor, drooling, sore throats, nasal congestion, adventitious lung sounds are indications of a respiratory infection, and we need to be cautious. Treat for hypoxias, assure the ABCs, ventilate as necessary, consider some fluids, consider some bronchodilators. Rashes are the most common in many illnesses that have characteristic rashes, can help us assist in their diagnoses. Nausea, vomiting, diarrhea are common with GI illnesses. They're prone to dehydration, so consider some fluids. Vaccination and good health reduces our risk of contracting those through our work. Using standard precautions and communication with other healthcare providers reduces the risk of contracting those illnesses and passing them on to others. Understanding that when we are passing a patient off to a provider, it is necessary for them to know if we've been told, hey, I have disease XYZ. It's not something that we can go and put up a big poster at the station. Here's our list of people in our community who have HIV. That's a violation of well, so many things. But it is important that if we know and we can pass it on to someone else that is the next person in line to take care of that person, that we do so.